Hello, I'm Dr. Inman. This is a miniature lecture on pneumonia and pneumonia, bronchopneumonia conditions, and also Heaves, sometimes called. You see it sometimes in the pigs called thumps too, where they'll basically cough and make a thumping sound. The horse, essentially, more prone to pneumonia than the domestic dog, essentially, in this regard. And again, we've talked about treating this animal with frequency-specific low-level laser therapy. These animals are adjusted as a matter of routine, because everything that we can touch, we basically will do that too. But what happens is that we'll go ahead and it will laser the thoracic inlet and also the lung field, particularly the lungs that are full of material, infectious material. Usually bronchopneumonia is a bacterial infection, so concomitant antibacterials are used to try to take care of that. And when we use the laser therapy using the 784 frequency for infection, we use 73 for lymphatic improvement. We use 230 for lymphatic drainage, essentially, and then we also use, excuse me, and then we also use 100 for the actual lung field. We very commonly can also use 363 as a means to optimize the mucous membrane inside the actual upper stem bronchi and also the alveoli area, essentially, of the body. These frequencies have worked relatively well. They accelerate therapy with or without antibiotic therapy. I would not recommend treating an animal with acute bronchopneumonia with just laser, although we have in past and successfully been able to take care of that. If we have the availability of antibiotic therapy, why not use it along with this? Our goal is to try to get the animal better as quickly as possible with the highest degree of success and least cost. And so these approaches essentially have been worthwhile. We'll laser the animal twice a day for 3 days, once a day for 3 days, and then twice a week for 2 weeks. That's about 1 day short of 3 weeks, and then what that does is allows us to have the animal probably out of danger within about 2 or 3 days, and then the lung field sterilized for pathological bacteria within a week. We probably laser them the last week just to make sure. This has been a lecture on on bronchopneumonia and pneumonia, essentially, in the domestic animals and how we go about treating it. It is not a very difficult disease condition for us to treat with or without antibiotic therapy. I'd have you go to the vomtech.com website and look at the frequency-specific low-level laser therapy data. We'll give you a lot more information on how the technique works, why it works essentially, and how to apply it in your practice. Thank you, and have a great day.